On today's Tell Dr. D, addiction. From chocolate to OxyContin, talk of addiction is a part of everyday life. For every story of a celebrity that's lost it all, are tens of thousands of real people who struggle with addiction. Today, we're going to hear these stories of some amazing individuals that have faced addiction. Tell Dr. D starts right now. Hi, I'm Dr. Dale Archer. Today we are talking about addiction. As a psychiatrist and the medical director of an addiction clinic, I have seen people become slaves to their dependence on drugs and alcohol. And I will tell you that nothing beats the feeling of seeing them walk through the door happy, healthy, and clean. We know that the brain plays a major role in all addictions like pornography, shopping, eating, sex, internet, and gambling. But today we're talking primarily about drug addiction, and in particular narcotic painkillers. A drug addiction is when the body physically and psychologically depends on a substance for normal functioning. When that drug is suddenly removed, it causes withdrawal and cravings. Physical dependence is caused by the need to prevent withdrawal symptoms, while psychological dependence often means a compulsive need for the high from the drug. Did you know that 1 in 8 Americans have a significant problem with alcohol or drugs? And 40% of those have a concurrent psychiatric diagnosis. So many folks do indeed self-medicate. Narcotic painkillers are the fastest growing category of addiction in the country and will probably pass marijuana as the #1 drug of abuse this year. The problem is narcotics are extremely addictive. This means that we have to ramp up our efforts to discover the biochemical aspects of this disease. Coming up, we have an incredible guest and several stories about addiction. Stay tuned. We'll be right back.
Next on Tell Dr. D.
When I got up in the morning, it first started off with 1, and then it started off with 2 in the morning, and 3 in the morning, and 4 in the morning, and 5 in the morning, and sometimes 6 in the morning before my feet hit the floor. Sometimes 40 a day.
30 or 40 pills a day.
Yeah.
And did you ever try to quit?
Yeah.
A lot.
But that wasn't happening?
No.
Have you gone from being someone who was productive and happy, who enjoyed life and time spent with friends, to a person alone and confused? You can turn it around like others who have gotten help.
Have you or a loved one become addicted to pain pills or other opiates? If so, Behavioral Health Group's Lake Charles Substance Abuse Clinic can help. Please call 337-433-8281 to schedule a confidential appointment.
At Memorial, we get that women are different and that you have special needs and wants, like modern birthing suites, the latest breast health diagnostics, advanced neonatal care, and other women-specific services. As a mother, daughter, sister, wife, and grandmother, you have many roles in life, and so should your health care. That's why there's Lake Charles Memorial Hospital for Women, a special place that understands your life. We are Memorial for Women.
If you or a loved one is experiencing depression, anxiety, or bipolar disorder, there is help locally. Bridgeway Psychiatric Center offers a day treatment program that combines medication management with psychotherapy to decrease symptoms and help clients get back to the things they enjoy. If these symptoms describe you or someone you know, Bridgeway can help. Bridgeway Psychiatric Center provides effective treatment without the confinement of a hospital. For more information or to schedule a confidential screening, call 562-0211.
Today's topic is pain pill addiction. My first guest is Brandy Evans, who is treating her addiction with the newest treatment we have called Suboxone. Hi, Brandy.
Hi, Dr. Archer.
Thank you so much for joining us.
You're welcome.
Yeah? You seem a little nervous today.
Yeah, a little bit.
Okay. Well, I know that you've been clean for what, about 2 years now?
Mm-hmm. 2 years.
All right. What I want to do is I want to go back to when you first started getting involved with drugs, and in particular pain pills. How did that start?
Actually, I was dating someone, and it just started off as kind of like an every now and then thing.
Okay.
And then once he and I separated, and this has been,
How long ago was that?
oh God, probably about 11 years ago.
Oh, 11 years. Okay.
Yeah, so it's been on and off for that long. I actually sat down and counted, and I thought, golly,
All
you
right.
know. So it's been a long time.
So boyfriend got you
Yeah.
involved with him. You started taking him initially to get high, which is a little
Yeah.
different.
I
I would say that the average person usually gets involved when they have real pain. They go to see a doctor. The doctor prescribes the med, and then they end up liking the high better than they like the pain relief. And even when the pain's gone, they start making up a story and getting more and more pills. That is not as common when you start off for the high right off the bat.
No.
So obviously you liked it.
Well, yeah, at first I didn't know what it was, and I took it and I thought, okay, well, you have all this energy and you can do all these things.
This feels great. Wow,
Yeah,
what could go wrong?
Yeah. And then I realized that, oh, well, you didn't have anything, or you just kind of got sick.
Didn't
I
feel
thought,
quite as good.
No, it didn't.
Okay.
It didn't feel good at all.
How long would you say that it took you from the time when you first started taking it recreationally to you realize that you were hooked on the drug?
It's here recently is whenever I really started. Well, let's see, probably about 5 years ago, because I was on him for about 3 years.
So you were taking them on and off for about 3
Yeah.
years, and about 5 years ago you woke up one morning and said, I got to have these every day.
Yeah, I had to have them every day, and I mean it was up to.
How many pills a day were you taking?
When I got up in the morning, it first started off with 1, and then it started off with 2 in the morning, and 3 in the morning, then 4 in the morning, and 5 in the morning, and sometimes 6 in the morning before my feet hit the floor.
Before you even got out of bed?
Before I even got out of
and
bed.
this is 6 of the, we're very strong what? Lorcet?
Lorcet 10, 6, 15.
Lorcet 10s. And then how many would you take in the course of a day?
Probably about 3 or 4 hours later, I might take 2 or 3 more. A couple hours later then I'd take 2 or 3 more, and it was just an ongoing thing.
So you had to take them all day long. What would you say, 20, 30?
Probably, I'd say 30, sometimes 40 a day.
30 or 40 pills a day?
Yeah.
Well, I will tell you that I have treated folks that have taken 100 pills a day.
Yeah.
So, okay, so you knew you had a problem. That was 5 years ago. What then? What happened?
Well, the only thing really to do was, go to Houston.
So when you say go to Houston, you went to a big city. Obviously, Houston is known as having a lot of pain clinics where it's very easy to procure these drugs. So you started going there, seeing more than one doctor?
Mm-hmm.
Okay, so you would go see several doctors, get your pills. And did you ever try to quit?
Yeah.
A lot.
But that wasn't happening.
No. All right. Explain what would happen when you would say, you know what, I've had enough of this. I got to get off this drug. I'm just going to stop.
Or when you can't find any. That's the thing. You're sick. You have cold chills. You have no energy. You can't get out of bed. You're sick to your stomach. It's almost like having the flu. You feel
I would say that I've heard